Hello and welcome to Health Bulletin. Today we bring you critical updates on the COVID-19 pandemic as the virus continues to evolve and affect regions around the globe. From new variant hotspots in the UK to rising cases in the Western Pacific region, the pandemic remains a global challenge. How are different countries responding? And what does this mean for the future of public health? Let's dive in. A new COVID variant, known as XEC, is surging in the United Kingdom, with health experts warning that it's just getting started. First detected in Germany in June 2024, XEC has since spread to Denmark, Ukraine and now the UK. It's believed to have a slight transmission advantage over previous variants, which could make it the dominant strain this winter. Data shows that Carlisle has the highest infection rate, with 10.8 cases per 100,000 people. While vaccines are still expected to provide strong protection, experts like Professor Francois Balloux from University College London are urging people, particularly those at higher risk, to get their booster shots as the UK braces for a potential winter wave. Over in Taiwan, the government has launched its annual free vaccination program covering both flu and COVID-19 vaccines. The program, which kicked off on October 1st, prioritizes vulnerable groups such as the elderly, healthcare workers, and people with chronic illnesses. Taiwan's phased rollout is an attempt to curb both seasonal flu and potential surges in COVID-19 cases as we head into the colder months. With over 5.5 million doses of COVID-19 vaccines purchased from Moderna and 3.15 million flu vaccines already available, Taiwan is once again proving its commitment to public health. It's also a reminder that while the pandemic may no longer be front-page news, governments cannot afford to let their guard down. Meanwhile, in New Zealand, COVID-19 cases are climbing again, with 1,039 new cases and 4 more deaths reported in the past week. The country has also detected the XEC variant, which could soon become dominant there as well. The government has ended its free distribution of rapid antigen tests, signaling a shift in pandemic management, but the rising case numbers show that COVID-19 is far from over. The question remains: are we prepared for another potential wave, or have we become too complacent in our pandemic response? In the United States, Florida continues to see an alarming rise in COVID-19 related deaths. The state has reported 4,781 deaths this year alone, bringing the total death toll since the pandemic began to nearly 100,000. Miami-Dade County has been hit the hardest, with 455 deaths reported so far this year. Although the death toll is lower than previous years, these numbers are a stark reminder that the pandemic is still claiming lives, particularly in areas where vaccination rates remain lower than the national average. As COVID-19 transitions into an endemic phase, how will the US government address these ongoing fatalities? Turning our attention to the broader global scene, the World Health Organization has released its bi-weekly COVID-19 situation update for the Western Pacific region. The latest data shows a 6.3% positivity rate across 11 countries, with New Zealand and the Philippines reporting an increase in cases. Of particular concern is the JN.1 variant, which has become the dominant strain in the region, accounting for 85% of new cases. With multiple variants circulating, the Western Pacific region continues to face challenges in containing the virus, despite the widespread rollout of vaccines and testing. So what does this all mean for the world as we move into 2025? COVID-19 may no longer dominate headlines, but it continues to evolve and spread, impacting lives, economies, and healthcare systems across the globe. The emergence of new variants like XEC and JN.1 highlights the ongoing need for vigilance and adaptation. Governments are rolling out vaccination programs and adjusting their strategies, but are we moving quickly enough? Are global powers prioritizing public health, or are we underestimating the virus once again? The pandemic may have changed, but the threat remains. Thank you for watching Health Bulletin. Don't forget to subscribe for more updates on global health and science.